How you doing, everybody? Dr. Dex Alvarez here with Palma, Ceia Chiropractic and Wellness Center. And I wanted to share a quick story from a reevaluation that we had in the office yesterday that I thought was really cool, because as a chiropractor, I take a lot of this stuff for granted, that as we're getting patients feeling better, because a lot of patients come in with typically neck pain, mid-back pain, lower back pain, but we also get some of these other body functions working a lot better. And unfortunately, I take it for granted sometimes because we're in it all day. But yesterday I had a patient, we were doing a reevaluation. She had an issue in her neck from this coronavirus, sitting at home on a dining room table, typing away on her laptop. Neck and upper mid-back really started giving her a problem. So as we started to correct these issues, it also came out yesterday that she hasn't taken Nexium in about 2 to 3 weeks, which for her is crazy. She's been on some type of an acid reflux medication for the past 20 years. And she hasn't really changed anything other than getting adjusted. She's kept the same diet, she's kept the same exercise routine, she's still sleeping propped up with a bunch of pillows, which is uncomfortable, but what she has noticed is that her acid reflux has almost completely dissipated. So as we were talking through, we were reviewing her x-rays and her neck curvature, which should be at a 45-degree angle. She only started off at 4 degrees. So she had 96% loss of that overall curvature. We've gotten her into the 20s now, halfway through her care. And what that does is it removes a lot of tensile force off your spinal cord and off the C3, 4, 5, and 7 nerves in your neck, which all those nerves are the ones that come together to plug directly into your diaphragm. Your diaphragm has a little valve in it that separates your stomach from your esophagus. So when we start to affect those areas and we start to eliminate the pressure being placed on those nerves, your brain is able to communicate over those nerves, over your spinal cord, to that valve to tell it to tighten up. So with the 96% loss of curvature in her neck, there was just no way that that message was getting to that valve at 100%. So the valve was staying sluggish. It was staying open slightly, so it was causing a backflow of acid. So as we started to remove that interference, we started to affect those areas, that valve starts to tighten back up. It starts to learn to stay tight again. And that way we prevent that backflow of acid. That's what started to really prevent this acid reflux from continuing to occur. So 20 years of Nexium, Tums, all those different acid reflux types medications, she hasn't taken in over 2 weeks. So now we're going to continue to maintain this, make sure that we started talking about ergonomics so we can start to correct her neck and make sure we keep it that way. But I also want to make sure that she doesn't have this acid reflux come back. So she was extremely happy, and so were we, to be able to see this incredible change in someone only halfway through care, but it was because we started to remove that interference. So hopefully, I like to kind of drop these kind of stories to try to start linking, body function stuff to starting to eliminate these pains and discomforts, but also getting your body functioning the right way. So I hope it starts to shed some light for some patients out there to let you know that there are some different ways to manage your care. So if you have anybody, if you know anyone suffering from these types of issues, or if you're suffering from it yourself and you're looking for another way to manage this, please feel free to reach out to the office. We want to make sure we do a fully focused exam, take some x-rays if needed, so that way we know if this is even an issue we can work on, and make sure that we can get it corrected the right way for you and keep you to maintain that for a lifetime. So I hope you guys have a great rest of the day. Take care. I'll talk to you soon.